The broadcast of the regular meeting of the Minneapolis City Council will now begin.
Thank you. Good morning. I'm Lisa Bender. I'm the president of the Minneapolis City Council. I'm going to call this regular meeting of the City Council to order for May 8th. I'll note that this meeting has remote participation by members of the City Council and city staff as authorized under Minnesota statutes section 13D.021 due to the declared local public health emergency. At this time, I will ask the clerk to call the roll so that we can identify a quorum for this meeting.
Council Vice President Jenkins.
Here.
Councilmember Schrader.
Here.
Councilmember Cunningham. Councilmember Ellison.
Present.
Councilmember Goodman.
Present.
Councilmember Johnson.
Here.
Councilmember Palmisano.
Present.
Councilmember Gordon.
Here.
Councilmember Kano.
Here.
Councilmember Reich.
Here.
Councilmember Fletcher.
Here.
Councilmember Cunningham.
Present.
Council President Bender.
Here.
There are 12 members present.
Let the record reflect that we have a quorum. Colleagues, the agenda for today's meeting is before us. Are there any amendments from council members? Seeing none, may I have a motion to adopt the agenda?
So moved.
Second.
Thank you. Mr. Clerk, please call the roll.
Council Vice President Jenkins.
Here.
Councilmember Schrader.
Aye.
Councilmember Cunningham.
Aye.
Councilmember Ellison.
Aye.
Councilmember Goodman.
Aye.
Councilmember Johnson.
Aye.
Councilmember Palmisano.
Aye.
Councilmember Gordon.
Aye.
Councilmember Kano.
Aye.
Councilmember Reich.
Aye.
Councilmember Fletcher.
Aye.
Council President Bender.
Aye.
There are 12 ayes.
That carries and the agenda has been adopted. Next, we have acceptance of the May 1st meeting minutes. May I have a motion to accept those minutes?
So moved.
So moved.
Second.
Thank you. Clerk will call the roll.
Council Vice President Jenkins.
Aye.
Councilmember Schrader.
Aye.
Councilmember Cunningham.
Aye.
Councilmember Ellison.
Aye.
Councilmember Goodman.
Aye.
Councilmember Johnson.
Aye.
Councilmember Palmisano.
Aye.
Councilmember Gordon.
Aye.
Councilmember Kano.
Aye.
Councilmember Reich.
Aye.
Councilmember Fletcher.
Aye.
Council President Bender.
Aye.
There are 12 ayes.
That carries and the minutes are accepted. Next, we have the referral of petitions, communications, and reports to the proper committees. May I have that motion, please?
So moved, Madam President.
Second.
Thank you. Mr. Clerk, please call the roll.
Council Vice President Jenkins.
Aye.
Councilmember Schrader.
Aye.
Councilmember Cunningham.
Aye.
Councilmember Ellison.
Aye.
Councilmember Goodman.
Aye.
Councilmember Johnson.
Voting on.
Aye.
Councilmember Palmisano.
Aye.
Councilmember Gordon.
Aye.
Councilmember Kano.
Aye.
Councilmember Reich.
Aye.
Councilmember Fletcher.
Aye.
Council President Bender.
Aye.
There are 12 ayes.
That carries and those matters are referred. With that, we'll proceed to the order of new business, beginning with the mayor's weekly report on the state of our local public health emergency. Welcome, Mr. Mayor.
Thank you, Madam President. Thank you so much for your partnership on everything from health regulations to homelessness is greatly appreciated. And council members, thank you so much for the ongoing collaboration. It means so much during this crisis, and I miss hanging with all of you. I really do. So it is yet another Friday, and we have some remarks to give with respect to the state of our city during COVID-19. We have still 11 emergency regulations to date that have been passed through. The health report by the numbers as of 4 p.m. May 7th shows a total approximate number of completed tests at 97,421. That's up 27,000 from last week, and the number of daily tests continues to increase pretty substantially as we continue to work our way up towards the goal that Mayo Clinic and the University of Minnesota has had of 20,000 per day. As we know, testing capacity is going to be critical as we determine how and when to open. Total positive cases in Minnesota are 9,365, which is up over 4,000 from last week. Last week we were up roughly 2,000. So the number of cases is increasing, obviously, but also the number of increases is also increasing. Patients who no longer need to be isolated is at 5,308. That's up 3,000 from last week. Fatalities total 508, which is up 150 from last week. And deaths among cases that resided in long-term care or assisted living facilities are 407, so still a very strong majority. Hennepin County positive cases are 2,962. That's up 1,200 from last week. Deaths in Hennepin County are 342. And the number of positive cases with our healthcare workers is 1,205. Minneapolis case information. Total positive cases are 944. That's up nearly 500. It's a pretty substantial uptick. Total hospitalized is 246, and total recovered is 232. The total deceased in our city is 77. As far as hospitalization goes, the total cases requiring hospitalization was 1,459, which is up 400 from last week. And there's 435 that are hospitalized as of today, and 182 in the ICU today, which is up about 50. This week's graph shows more of an equalization among Black, white, and unknown. I say equalization intentional is that it is not necessarily equitable. We see around 30% for all, 30% for Black, 30% for white, 30% for unknown, and that's by race. And then you can also see the ethnicity statistics as well there. I see a question just pop up from Councilmember Jenkins.
Yes, Mr. Mayor, thank you. Council Vice President.
Thank you, Madam President. Thank you, Mayor. I don't have a question. I just, we hear these numbers every week, and I just wanted to just take a moment and just say my deep condolences to the 77 family members who have lost a mother, a brother, a son, a niece, a nephew. It's so tragic, this disease, this virus. So I just wanted to just take a moment and acknowledge that and offer those condolences. Thank you so much.
Thank you, Council Vice President.
Yeah. Thank you, Council Vice President. It's easy to just get caught up in a reporting of numeric data, and I really appreciate your grounding that data in a sense of people and families that are impacted on a daily basis. And so thank you for doing exactly that. Moving forward to the health department numbers and first congregate care facilities. Following the latest emergency regulation, outreach to congregate health care facilities continues with the health department, and they are providing ongoing support and mitigation efforts around staffing, PPE, and sanitation supplies, and general public health guidance as well. For contact tracing, until this week, MDH has been doing contact tracing, but now our health department will undertake case investigations and contact follow-up for individuals diagnosed with COVID-19. With contact tracing, the national criteria, that the national goal is generally that for every person that tests positive, you need to find at least 10 additional people to test to see who they've come in contact with and whether those individuals have contracted the virus. There's not a single state that's up to that goal as of right now. And obviously contact tracing and testing in and of itself will help us a whole lot in determining how to proceed. 12 MDH staff are being trained and will begin work this Friday. An additional 10 city staff will be trained next week, and Human Resources has been asked to identify staff within the city and outside the health department that may be well suited for this work. I've talked substantially about this, but many employees within our city are now properly transitioning to jobs that they didn't necessarily sign up to do. I appreciate their work. I appreciate the fact they're willing to step into something that they didn't anticipate from day one when they entered City Hall or entered whatever, wherever their location of work is. But this is necessary right now to remain flexible as an enterprise, and we really appreciate our staff that are willing to do so.
Thank you, Mayor. Councilmember Cunningham has a comment or question.
Thank you, Madam President, and thank you, Mr. Mayor. On the last slide, I just wanted to just name, while we still have a large number of unknown cases, that 30% of the cases being Black folks in Minneapolis, I think is something that's also noteworthy because that is a disproportionate representation in comparison to the rest of the city. And so, and this is what we're seeing across the country in major cities. And so it's worth pointing that out we've watched it pretty much double in about a week or so with Black folks being identified as cases. And so I just think it's really worth noting that this is, it's not a coincidence that this has happened. It's not an accident. Like, this is long systemic situations and discrimination that really at all levels of government that have led to these sort of outcomes. And so I'm grateful for the leadership of the mayor and of this city council to be able to really look these numbers squarely in the face and say, what is our responsibility to do now in this moment? So, so thank you for your leadership, Mayor, and let's dig into this and figure out how we can ensure that we are thinking about racial disparities in not only the health outcomes, but also the economic impact. So thank you, Mayor.
Thank you, Council Member. As you correctly pointed out, the jump in just the last week has been pretty substantial. And there are many reasons for that, and as we've seen the disproportionate impacts in other cities. I wanted to just call on Commissioner Musicant to see if she can provide some additional information regarding what we just talked about.
Thank you, Mayor, members of the council. Yeah, I wanted to talk just a second about the unknown, and that is not a static number. The State Health Department is responding to an interest in seeing data right away. And so they are releasing information every day. Sometimes they are just in the middle of trying to contact people who have had a positive test and so have not been able to speak with them at all. And so really, because the laboratories that are doing the testing are not usually coding for race, it isn't until the contact tracing begins. So we will see that number of unknown fluctuate, and it's not static. It doesn't mean that forevermore those cases are unknown. They will probably become, a good portion of them become known. We are also working with the State Health Department to disaggregate the Black category so that we can see African American and East African as two distinct populations within that number. We have an agreement from them that they are going to go back and look at their past cases so we can better understand that going backwards and ask proactively more questions as part of contact tracing so we can better understand that number going forward. And I think that will be helpful as we continue to tailor our community-specific responses.
Thank you.
Mr. Mayor, if I can just jump in here too, I just kind of want to highlight a thread here in some of these comments and questions, which is that I think we see sort of evolving partnerships with our partners at the county and the state as we all grapple with new sort of pressure on all of the work and working really quickly. And so I think we have so much expertise in our city, in this example, in our local public health department that knows our community, that can flag and highlight some of those specific local concerns in our specific populations, especially in our cultural communities where the health department has deep relationships. But we don't have the capacity as a city alone to fully respond to the needs of our population. So as testing increases, thankfully, under the new initiative that the governor announced a couple of weeks ago with the Mayo Clinic and the university, as that testing ramps up, we will start to see, of course, more positive cases. We'll be able to rely on the local expertise to help flag any of these, concerns in our local populations. But then the response related to quarantine housing or hospital beds or all of those statewide and regional issues are things that we're doing in partnership with the county and the state. And I think those partnerships are working really well in some ways. And I think in other ways, because it is also new, everyone's still kind of working out the kind of distribution of responsibilities and, of course, the funding for all of the different needs in all of our overlapping communities. So I just wanted to highlight that. I'm super thankful to the public health department for all of their work and that local knowledge and expertise that they bring, and to my colleagues for raising these questions and issues that are unique in some ways to our populations. But I also know that across the state we have diverse populations, and that local governments in smaller communities than ours will also be grappling with some of these same questions and same issues as they start to see different effects in their populations. So I just wanted to name that some of that deep work that's happening at the staff level and at the policymaker level around these relationships and partnerships.
That's right. Well put. The next topic for our slide presenters is Mental Health Month. So May is Mental Health Month, and a mayoral proclamation has been signed to draw to attention to mental health well-being during COVID-19 pandemic, and as people are increasingly isolated and unable to connect with their families and communities around them, mental health is going to become all the more important right now. And so big thank you to our mental health providers that are stepping up to the task. Mental health providers from East African and Hmong communities will be guests on Kali and WIXX to talk about mental health well-being concerns. Last month, the health department recruited a presenter to speak about family stress, including domestic violence and COVID-19 on KMOJ as well. Next is mask drive and distribution. As you know, last week I reported a total of 6,144 cloth masks were donated to the city as part of Governor Walz's call to action on April 25th. And as of May 6th, 83 organizations have submitted requests for the donated masks. An initial round of 37 establishments, including food shelves, community clinics, farmers markets, cultural nonprofit organizations, small businesses, daycares, and low-income high-rise residents will receive their requested allocations starting on May 7th and 8th via delivery and curbside pickup. MDH continues to perform outreach at long-term care and congregate living facilities to identify residents that also need cloth masks, PPE, and other hygiene supplies. For the slides, I'm now moving on to office and emergency management and workforce. There you go. The city's workforce continues to maintain normal workforce strength and essential functions of government. The daily rate of workers on duty is consistently between 89 and 91% of the total workforce, which is exactly what it's been for the last several weeks. Approximately 79% of workers on duty are working remotely, excluding police and fire. And OEM's efforts remain focused on the situational awareness of trends, impacts, offering guidance and support across the enterprise. Next topic is procurement. The total spend as of May 6th, 2020 was $4,777,868. And I want to make very clear that this does not include the work of our staff that have in many, many cases entirely transitioned to dealing with COVID-19 response. If you were to take into account that figure, it would be many, many, many times that which we've spent in terms of procurement. The total increased, I mentioned the total spend was $4,700,000 some odd thousand. The total increased was $1,587,400. And part of that is in CPED. It's contracts for small business lending with $1,530,000 going out the door. Citywide cloth mask purchases and the work that the city council and the mayor's office did, $33,900, and then the city coordinator's office support for artists, $20,000. Next is budget. We are in the process of preparing dual processes for budgets. As amended 2020 budget in June, and then a 2021 budget presentation to council in August. As the state's revenue forecast reflected this week, we'll see significant revenue shortfalls. And that number is upwards of 200 million. We will need to make adjustments to navigate through that reality. And we're looking forward to engaging our labor partners and amending collective bargaining agreements to institute wage freeze broadly across the enterprise. And these actions will be necessary now to help guard against further cuts later. And these significant revenue shortfalls that we're seeing really call the issue of state funding and federal funding. And these bills are up before the legislature right now that would allow us to get a share of the CARES Act. As of right now, we have not gotten any. And I'll be touching on that in a minute, but it does have implications, broadly speaking, across our budget.
Thank you, Mayor. We have a couple of council members in queue. Councilmember Schrader.
Thank you, Madam President, and thanks as this week too, Mr. Mayor, for all the work you're doing and all the staff throughout the city. We miss hanging out too. I do have just a kind of a question back a couple slides just on the need for PPE. That's great news about the just kind of the cloth mask drives and how they're going, but it would be helpful to know kind of how close we're getting to meeting that need and how that kind of need changes.
Council member, that is an excellent question that I do not know the answer to offhand, but if Barrett Lane is on the call, perhaps he can give us a rundown for some of the needs that we're seeing both internally in the enterprise as well as citywide. I know we've got our enterprise needs covered, but I'm certain there are issues where we have not been able to cover more broadly.
Thank you, Mr. Mayor. To switch gears here, I think really as far as the cloth masks, is that what the issue is that you're asking about specifically, Council Member? I just want to make sure I understand the question.
PPE in general, it's okay. Mainly a matter of like what is going to be that need. I think cloth masks fill some of that, and people can donate that, but there's other things we'll need to purchase that just are not accessible otherwise.
Yes, thank you, Council Member, Mr. Mayor, Council President. We actually are in good shape with respect to internal PPE supplies. We've been able to both provide support to the community with respect to personal protective equipment, particularly masks, surgical masks and N95s, as well as maintain a supply that's sufficient to cover first responder needs. So our internal PPE needs are reasonably stable, and they'll be stable for the near future. Our project right now is to make sure that cash is able to sustain operations should there be a second wave in the fall. So we're going to be good at least through September. Our next project is to sort of look at that next 6-month period starting with September. Now there's a lot of community needs out there, But as the supply chain continues to kick in, we're seeing more supplies become available through the state EOC and other sources. So in general, the picture with respect to PPE gets better, but certainly there are needs in the community where there are still gaps, and perhaps Commissioner Musicamp would want to comment specifically on some of those community needs.
Yes, thank you. I'm trying to think of a title for you, Barrett. Director, yes, Lane, thank you. Yes, we continue to collect needs from the community. We have a forum where we're hearing about those. We're also looking for other sources for personal protective equipment that aren't necessarily just through the budget process. We were just informed by the CDC Foundation that they have several pallets of hand sanitizer in the personal use size. And so we have told them, yes, we'll take those, and we plan to distribute those to community organizations and others we've heard from who are needing that. So it's not only a need that we're trying to meet through our spending and our procurement, but we're also trying to be matchmakers between resources that we learn about and the needs in the community. But it isn't anywhere where we say, gosh, we're done with that now, because much of this equipment continues to be used and need to be refurbished and resupplied.
Oh, thank you.
Thank you both.
Thank you, Councilmember Schrader. Excellent question.
Council Vice President Jenkins.
Thank you, Madam President and Mayor Fry. My question is also related to a couple of slides back in the face mask drive and distribution, and really just trying to figure out is and maybe Commissioner Musicamp or Director Lane might be able to answer this too, but is the only way that we're getting things out, PPE out to communities, is through this form? I'm just concerned that I haven't seen any mask drives, giveaways, PPE, anything in South Minneapolis, and I'm not sure if the organizations are aware of this process, and is there some communication that we can help put out to make people aware? And you know, I just want to make sure that this community is not overlooked in the processes. And I know I see every day multiple groups and organizations and efforts in North Minneapolis, and want to make sure that those same kinds of supports can be available for the residents here in South Minneapolis.
Commissioner Musicamp.
Thank you, Mayor and Council Vice President Jenkins. Yes, we have a whole branch in our response team, community engagement, and we are leaning in. We are not just passive recipients of requests. And so we are connecting with organizations, especially prioritized by the governor, but others as well, to make sure that they have supplies and that they know about the process of letting us know about their needs. I will share your concern with that team and make sure that we are leaning into your community as well.
Thank you so much, Commissioner.
Thank you. That looks like the questions we have so far, Mr. Mayor.
Thank you. Next topic is public safety. We've seen 30 gun recoveries this week citywide. Year to date, 369 guns have been recovered, which is a 40% increase, very substantial from the same time in 2019, which had 264 guns recovered, and that year actually also had a relatively higher gun recovery rate. This week there have been 43 aggravated assaults, 14 of which are domestic assaults. Domestic assaults are up 17% week to date and down 13% year to date citywide. I'll note that half of the domestic assaults were in the 4th precinct. Enforcement of the governor's order to date, MPD has not issued any citations or arrests. Traffic control continues to provide an active presence in promoting physical distancing around small parks and school playgrounds, and we've been in constant communication with our park board superintendent, president and vice president around these issues. From April 29th to May 5th, there were 11 complaints at 6 locations for lack of physical distancing. Matthews and Stewart Park had multiple complaints during the last 7 days. We expect an increase in complaints, especially as the weather gets nicer and people are feeling the urge to be outside. For fire, this is about the 2020 EMS Academy. The 2020 EMS Academy has been postponed as of right now because Hennepin County did not feel that they could facilitate the in-classroom instruction at this time due to the COVID-19 crisis. We are still working through this one right now, as we know that EMS are incredibly critical during this period. We do hope to resume in as quickly as possible and certainly in the fall of 2020. As for needle pickup, the fire department has seen an increase in requests, in some cases pretty substantial. These requests have been concentrated in South Minneapolis fire stations. Next is state and federal activity. On Tuesday, Minnesota Management and Budget Commissioner Myron Franz released an interim budget projection due to the economic impacts felt by COVID-19, and MMB officials are projecting a $2.43 billion deficit for the remainder of the current biennium, which ends on June 30th, 2021. This is a $4 billion swing from just 10 weeks ago. That shows how quickly things are changing from a fiscal standpoint in the face of COVID-19. At that point, MMB had released a February budget forecast projection, which was a $1.5 billion surplus. So going from a $1.5 billion surplus to a $2.43 billion deficit. Sales tax revenue to the state and then indirectly to the city is expected to be $1.35 billion less than the February forecast, and Minnesota wage and salary income is expected to decline by 5.9% this year and slowly rebound next year, but not reach pre-pandemic levels until sometime in 2022. You may have seen the unemployment numbers, which have gone up dramatically in the last month. We had, I believe it was the highest rate of filings for unemployment in the history of our country. So people are going to need help. People are going to need assistance. As for deadlines, the Minnesota legislature must adjourn by May 18th, leaving just 9 days left of the regular session. And on Monday of this week, all 4 House and Senate caucus leaders sent a letter to their members and staff asking that all community chairs and leads on outstanding legislative issues to finalize all agreements by Saturday, May 9th at midnight. The state has received its direct appropriation from the CARES Act COVID Relief Fund, and what is yet to be determined is how it will be appropriated both at the state level as well as to local units of governments that were left out from the direct funds from the feds. The governor has indicated that the $667 million of CARES Act funding intended for counties and cities will be passed to the legislature for decisions on distribution. I've been in contact with the governor, legislatures, and other mayors to relay the importance of aid to the cities. Late Monday evening, the U.S. Treasury released updated guidance for the COVID relief fund dollars, and that makes the uses more flexible. And I think it's still relatively unclear as to whether the governor is going to be, as to whether the decisions are going to be made by the legislature or the governor himself. And so they're still in the process, I believe, of working some of that out. Late Monday evening, the U.S. Treasury released updated guidance for the COVID relief fund dollars. That makes the uses more flexible, especially for reimbursements related to first responders. And these factors make the advocacy work at the state level for the distribution of these critical cities and counties even more important. For homelessness, and I'm going to pause briefly just to call on Jean really quick, just to clarify what I previously said, because I contradicted myself slightly. The decision as to whether the governor or the legislature is dispersing the CARES Act funds, I know has bills presently in the Senate that will be heard today. But I don't know that it's necessarily the entirety of the CARES Act funding that will be decided by the legislature themselves. Jean, could you further comment?
Mr. Ranieri, you may need to unmute your phone. And to do that, you would likely have to push *6 before speaking.
How about I'll continue on, and if Jean is able to...
I think I'm available. Can you hear me now?
We can hear you, yes.
Thank you. The governor and legislature are going to try and cooperate on how to expend the CARES funds, particularly that $667 million that the mayor talked about. Commissioner Cynthia Bowerly from the Department of Revenue has been asked to lead the administration's team to meet with the legislators. She also has some folks from MMB who will be accompanying her. There was a bill this morning in the Finance Committee in the Senate that basically transferred all the general fund money that was set aside several weeks, about a month ago, for state dollars to be used for COVID relief. All that money was taken out of that fund, put back into the general fund, and was backfilled with COVID relief funds, the $1.2 billion that's available to the state. On Monday, there's discussions in the Finance Committee, again in the Senate, to discuss best ways to get funds from the COVID relief fund to state and local governments. Senator Rosen, chair of the committee, has a bill that would get money out to every city and county in the state based on a formula, it's a per capita formula. There'll be a lot of discussion about that. There's some concern that shouldn't there be money more targeted to cities and counties where there are serious issues with COVID right now. So this will be an issue will take up most of our time in the next couple of days, and we will be meeting with our delegation. I think we have a meeting hopefully tentatively scheduled for Monday morning, and I'll stand for any questions.
Thank you, Mr. Ranieri. I think just a quick comment from me on this, which is alluding back to the earlier discussion. I think some of the discussion about budget is also about how the responsibilities are breaking down between local, city or town governments versus county governments versus state governments. And so the questions about budget, I think, are tied to the questions about who is providing which services and filling which COVID-specific health needs or housing needs. So those are things that, I know both the mayor and I have been in discussions about, and many of our staff, as we try to work out those relationships and partnerships across the government entities. Mr. Ranieri, do we have a sense of, from the funds that have come to the state, what expenses have already been incurred or how money may have already been spent? Is that available to the public?
Council President, I can get that information. I know the state has spent some CARES money, but I can ask for that information and get it to you. I don't have it off the top of my head.
Thank you. I don't see any other questions, Mr. Mayor.
Thank you. And, you know, this is arguably going to be the most important issue that is moving through the legislature in the next 9 or so days. You know, I know that I and many others have been in constant contact with our delegation here in the city, as well as representatives statewide. I've got a phone call coming up with Commissioner Byerly as well today. We want to make sure that the city is handling so much of these frontline issues. We are expending substantial resources on everything from homelessness response to health, and it is critical for our city, and by an extension, it's critical for the state that Minneapolis is able to partake in these funds. Homelessness. Protecting individuals experiencing unsheltered homelessness continues to present an extremely difficult challenge during COVID-19 crisis. Homelessness was a crisis prior to this pandemic and has been exacerbated since the pandemic began. And so we've been working very closely with our state and regional partners to balance the realities inherent in our housing crisis and the public needs of the moment. Yesterday, the council president and I spoke with the governor and lieutenant governor, along with leadership from several from our counties, St. Paul, Hennepin, and Ramsey, and we discussed the support we need in dealing with encampments, setting up appropriate isolation options, and the staffing necessary to support that work. That collaboration, it continues and is strong. And so both in the short term and longer term, we'll really continue to prioritize the health, safety, and dignity of individuals experiencing homelessness and unsheltered homelessness, while being responsive to the needs of our larger communities, and putting public health really at the forefront of our decisions. Next topic is elections. The Secretary of State's online absentee ballot request portal will open next Wednesday, May 13, and voters can use the website to request a vote by mail ballot for both the August primary and the November general elections. We strongly encourage voters to take advantage of this options and to go ahead and submit requests to get a vote by mail ballot for both elections next Wednesday. So take the precaution, make the request. The city's election team have posted a series of frequently asked questions with answers about the upcoming elections, as well as information about how to vote safely, whether voters choose to vote by mail or the in-person option. For GAP funding, starting next week, housing applicants will be referred to either MPHA or the community prevention partners on a rolling basis per their number on the randomized list. MPHA and CPPs will complete full eligibility and verification reviews for each referred applicant. For emergency housing assistance, the CPPs will send verified applicants to the city for final approval. Catholic Charities will issue checks on behalf of the program for approved applicants on the weekly basis. And then for stable homes, emergency expansion, MPHA will issue checks for approved applicants. For small businesses, the first 54 businesses have been notified and their loans were sent to services. This represents the first 480,000, and the program will serve the businesses who are traditionally left out. Recovery and reopening. While we're still adjusting to working remotely as a team, the conversation about what happens after is definitely on people's minds. Our Office of Emergency Management will lead the coordination of these efforts across the city enterprise. And as we continue to turn the dial, we're focused on a few key areas: on adapting to the changes we see coming from the governor's office, and remaining in close partnership with our state and our governor, getting Minneapolis and our city government as close to our pre-pandemic level of social and economic activity as possible, and then identifying opportunities and lessons learned to ensure we're a more resilient, equitable, connective, and innovative city as we recover and we rebuild. Importantly, in securing testing, in detecting where this virus is spreading, and in continuing to stay at home in some form, we are not preventing or reducing the ultimate number of people that contract COVID-19. Rather, we are reducing the number of people that contract COVID-19 all at once to the point where it would overrun our health system. That is a big difference, and one that I think needs to be recognized as we figure out next steps. And so I'll end there. I'm happy to stand for any additional questions. I very much appreciate each and every one of you.
Thank you, Mr. Mayor. Just one quick comment on this last point. I just want my colleagues and the public to know how important and focused we are on the topic of protecting workers through that process, both our own workers who are part of the city enterprise, as well as workers throughout our city. And as we talk about supporting businesses and getting back to economic activity, we are also have a staff team working on ensuring that we are doing everything in our power as a city, both as an employer and as an advisor, as a regulator, to make sure that workers are safe in their workplace. So, I think there's still a lot of details to be worked out around that as we look at what the federal and state governments might be doing around worker protections and any gaps we may need to fill at the local level. So that's happening in a little bit of a separate conversation, but I just wanted to make sure that folks knew that that was underway as well. Councilmember Fletcher.
Thank you, Council President, and thank you, Mayor. Mayor, I wonder if you could elaborate a little bit on what progress we're making on identifying shelter beds, whether that be ourselves or through our partners with the county and the state. I know that there is a significant need, and a lot of people are observing that the hotel arrangements that have been made have been very effective and helpful to the people we've been able to get moved into that kind of a situation. So I wonder if you can just share a little bit about what kind of progress we're making and what we might even be shooting for in progress in the next maybe couple of weeks.
Thank you, Councilmember Fletcher. We are looking at a sort of dual process right now, and all of this work happens in conjunction with the county. As you know, traditionally speaking, Hennepin manages our homeless shelter system, and that is a system we're looking to expand and alter to better adapt to the difficulties presented by COVID-19. And so, yes, hotel rooms are being added. They are continuing to be added, and they serve obviously people who are more vulnerable, and they serve individuals who have already contracted. And one of the pieces that we are very concerned about is the virus moving quickly through our homeless shelter system and/or a homeless encampment. And that's something that we're paying very close attention to, and we're, as you know, in collaboration with our state as well, to make sure that we've got a partnership that allows Minneapolis to get the resources that we need in order to fully attack this. And the truth is that we will need help. We will need help both in terms of resources and staffing. Resources, as we look at approximately a $200 million shortfall in revenues. We will need resources to do that necessary on-the-ground work that you just spoke of, and staffing. There is a high degree of expertise in working with our communities experiencing homelessness, and I want to give a big thank you to all of the individuals who are working tirelessly in our shelter. If you listen to the experts, what they will say is that shelters, by and large, need two things. We need to alleviate some of the burden with respect to space. In other words, providing more space to allow for proper physical distancing between beds, and we need to alleviate the burden in terms of staff burnout, because as these shelters are reaching, as they're at a very high capacity right now, it becomes difficult to do this week after week. And so I can assure you that we are working with the state right now to attack this quite head on. I don't know if the council president wants to elaborate any further. She's been in many of these conversations as well.
Yeah, thank you, Mr. Mayor. I was trying to find the most recent numbers. Last I knew that Hennepin County had added 400 hotel rooms that were fully operational, with 700 more on the way. And that data is probably about a week old. So it's possible if anyone from our housing staff that's been more in the day-to-day conversations wants to chime in. It looks like there's 600 beds operational now, with more on the way. I think a couple things I'll add to the mayor's summary. I think the first one is we're hearing from both Hennepin and Ramsey counties that while they work to ramp up the the hotel bed capacity, that one of the biggest challenges both there and in the shelters, where they have started to create more space for social distancing, that staffing is a really high need. They aren't able to find the operational capacity and staffing needed to operate those shelters. Now, that's what we're hearing from the counties. Of course, we are not the direct operator of those facilities. And so that is one of the asks that the county has made to the state of Minnesota, is help with that staffing gap that they are experiencing. I think another question that we all have is about just sort of as the testing reveals more cases, how to better systematize this, across jurisdiction partnerships on how to get people into those available beds as needed, whether they're coming from shelters or encampments or congregate living centers or other populations that may need quarantine or isolation housing. And I know that the governor's office and the state is working on creating a state leadership team and individuals shifting their job responsibilities to focus specifically on that. I think we saw when the state very quickly ramped up hospital bed capacity, how well it worked for the state to take the lead on that kind of statewide effort. And in the metro area, we were able to very quickly mobilize and identify, I think, 1,000 more hospital beds with the support of many local jurisdictions, including the city of Minneapolis. So it sounds like the state is now taking more of that kind of approach to the question around quarantine housing and shelter housing for folks experiencing homelessness. And I think that will really benefit all of our communities, all of the folks that are both experiencing homelessness, who are vulnerable to catching COVID, but also the other populations that may need temporary housing during the coming months. So we've been really willing partners in that. As the mayor alluded, for us, it would be an enormous financial challenge to try to take that out alone. I know the county has put in significant resources as well. So those are some of the details that I think are open questions around how we might be able to ramp up further capacity, is a funding question and then a staffing question.
That's right. Andrea Brennan, is there anything that you want to add? I know you've been working tirelessly on this particular topic.
Mr. Mayor, this is David Frank from CPED. Andrea is not on the call this morning, but she's been providing me with information as you and the council president have been responding very well to Councilmember Fletcher's question. And I think between the two of you, you have it very well covered, but thank you.
Thank you.
Are there any other questions or comments from council members? I don't see any. So thank you so much, Mr. Mayor, for your report today and for all the work you're doing. Great, thank you. So that concludes this item. I will direct the clerk to file this report. And that brings us to the reports from our standing committees. We begin with the Business Inspections and Zoning Committee, and that will be given by the chair, Councilmember Goodman.
Good morning, Madam President, members of the City Council. The Business Inspections and Zoning Committee is bringing forward 10 items for approval this morning. Item number 1 is an interim use permit for Thrive Youth Services at 3647 Fremont Avenue North. Item number 2 is granting an appeal on the site plan conditions of approval for a project at 240 Portland Avenue South. Item 3 are the liquor license renewals. Item number 4 is an alley vacation at 1626 East Lake Street and 2940 17th Avenue South. Item number 5 is a rezoning for Sister Karen Moyne at 1621 Fremont Avenue North. Item 6 is a rezoning at 187 199 Irving Avenue North. Item 7 is a rezoning at 2007 Glenwood Avenue. Item number 8 is a rezoning at 4534 Nicollet Avenue. Item 9 is also a rezoning at 911 West 24th Street. And lastly, item number 10 are lease revisions for the Community Care Clinics of Minnesota. I'm happy to answer any questions on any of those items, Madam President, and I'll move approval of items 1 through 10.
Councilmember Goodman has moved the committee report. Is there any discussion? Councilmember Cunningham.
Thank you, Madam President. I wanted to just take a moment to say that I am very excited to welcome Thrive Youth Services in the 4th Ward. They are a wonderful organization that is really meeting some nuanced needs for young people. This will be an emergency shelter for 8 young people between the ages of 8 and 13 in the Fallville neighborhood. I am so excited to be able to get to know them, support them, and see the wonderful work that they do. So I just wanted to welcome them and say thank you for choosing our community to bring your wonderful services. Thank you, Madam President.
Thank you, Councilmember, so much for highlighting that. And I'll note that that sort of arrangement, that sort of small site shelter wasn't allowed in our zoning code just a little while ago. And the council worked last term to update that part of our zoning code so that we were able to welcome more shelters, especially of that smaller size, with those kinds of innovative programs. So it's really heartening to see that it worked, and by making that available and legal in our city, that partners were able to take advantage of that change. It's really great. Any further comments or questions? Seeing none, clerk, please call the roll.
Council Vice President Jenkins.
Aye.
Councilmember Schrader.
Aye.
Councilmember Cunningham.
Aye.
Councilmember Ellison.
Aye.
Councilmember Goodman.
Aye.
Councilmember Johnson.
Aye.
Councilmember Palmisano.
Aye.
Councilmember Gordon.
Aye.
Councilmember Khanna.
Aye.
Councilmember Reich.
Aye.
Councilmember Fletcher.
Aye.
Council President Bender.
Aye.
There are 12 ayes.
That carries and that report is adopted. That brings us to the next committee report, which is the Policy and Government Oversight Committee, given by the Chair, Council Vice President Jenkins.
Thank you, Madam President. The committee has 15 items to submit to the council today. Item number 1 is the passage of an ordinance creating the Summit House Housing Improvement Area, HIA, along with 2 resolutions to approve the housing improvement fees and to issue bonds to finance the project, as well as project agreements with the Summit Homes Association and Western Bank Alliance. Item number 2 is the approval of a construction project and associated assessments for the Sheridan Avenue South Alley, located between Kenwood Parkway and Franklin Avenue West. Item number 3 is approving a workers' compensation claim by Kathy Lawler and authorizing the city attorney's office to execute any necessary documents. Items number 4 and 5 are approval of contract amendments for professional services for the public service building project. Item number 6 is the acceptance of additional grant funding from the Minnesota Department of Health to support response capabilities between July 1st, 2019 through June 30th, 2020. Item number 7 amends the city's federal legislative agenda to include recommendations related to support for local governments in response to the COVID-19 pandemic. Items 8 and 9 approve contract amendments related to the 10th Avenue Water Main River Crossing Project. Items 10, 11, and 12 authorize grant applications for federal and state transportation funding opportunities as reflected on the agenda. Item number 13 is the authorization of a temporary construction agreement in conjunction with the Girard Avenue South Street reconstruction project. Item number 14 is acceptance of a sole bid from Bray Sales Inc. for butterfly valves and actuators, all in accordance with city specifications. And item number 15 is the passage of a resolution which has been amended and corrected to accept a donation from Xfinity of airtime for public service announcements related to the 2020 census. This item was sent forward from committee without recommendation, but I will move approval of the corrected resolution that was circulated by the clerk on Wednesday evening. Madam President, I move approval of all 15 items.
Thank you. Council Vice President has moved the committee report. Is there any discussion? Seeing none, clerk will call the roll.
Council Vice President Jenkins.
Aye.
Councilmember Schrader.
Aye.
Councilmember Cunningham.
Aye.
Councilmember Ellison.
Aye.
Councilmember Goodman.
Aye.
Councilmember Johnson.
Aye.
Councilmember Palmisano.
Aye.
Councilmember Gordon.
Aye.
Councilmember Kano.
Aye.
Councilmember Reich.
Aye.
Councilmember Fletcher.
Aye.
Council President Bender.
Aye.
There are 12 ayes.
That carries and the report is adopted. This brings us to the order of announcements. Are there any announcements from council members? I don't see any. Before we adjourn, I just want to pause and really acknowledge and thank all of the work that goes into broadcasting these meetings several times a week. And we have amazing staff from the clerk's office, communications, and IT who have really gone above and beyond to very quickly get us ready to be in this remote environment, that have helped us troubleshoot technical issues, that are spending all of this time helping with each of these broadcasts, troubleshooting issues as they come up, in addition to preparing us for each of our meetings. So I just wanted to pause and say that now that we've gotten into a bit of a rhythm here, I'm able to get through a meeting with my technology working and have the time to say that here before we conclude. So just my heartfelt thanks to each of you on behalf of my colleagues for all that you're doing to enable us to still serve the community in this way. And we are very earnest in our desire to make sure that our meetings are accessible, that folks can call in and participate during the 2 committee meetings and our public hearings. And we're doing our very best to continue to serve the people of Minneapolis in this new way. And that would not be possible with all of the efforts of staff, including those who are supporting each of these meetings. Mr. Clerk, and then Council Vice President.
Thank you, Madam President, and don't want to jump the gun if it's coming from others, but before we adjourned, I wanted to be able to offer to all of you to whom it's applicable, all of our employees and community, a happy Mother's Day coming up on Sunday.
Thank you, Mr. Carl. Council Vice President.
Thank you, Madam President and Mr. Carl, for that recognition. I just wanted to acknowledge that I think it is Public Service Awareness Week, and if it's not, it should be. So I just want to echo your comments, Madam President, and really just say thank you to all of our public servants, including my colleagues on the council, for your service to this community. And I'm just so proud to be a part of this body and this work and this effort. Thank you so much.
Thank you, Council Vice President. I'm not sure about that. We did pass a resolution I think it was actually last week.
Madam President, you did pass a resolution, and the Vice President is correct. This week is Public Service Recognition Week. Thank you.
Of course, we passed the resolution last week declaring this week Public Service Week. So yes, thank you so much, Council Vice President, for that reminder. We were able to make those comments last week when we passed the resolution, but it's good to stop and acknowledge that again today. It is also Teacher Appreciation Week, and I know many of us have kids learning at home and are seeing our teachers go above and beyond to serve our community as well. So a lot of thanks to go around to so many who are coming together in our community. Any further comments or announcements? Seeing none, we have no further business before us, and without objection, I will declare this meeting adjourned. Thank you so much for everyone's service. Thank you. Happy Mother's Day, as the clerk said, to all who are celebrating this weekend. Thank you.
Have a great